Hey team, what are we down here? FitPro Health Clinics again, 109 Princess Street, Palmy North. This is the first in our series of those how your meds work type things I want to talk about. And as I said, I'm going to kick off with cardiovascular meds. Now, before we go into that, I need to explain to you exactly what how that system works, right? So how does the heart work, and give you a bit of background information on that before I can explain to you exactly how the medicines are affecting those different parts or components. And then what medicines are actually you've been given to help treat whatever symptoms it might be. So a bit of background. First of all, your heart. Right, so everyone's got one of these, keeps us alive, all the rest of that, you know all about it. Heart is a pump. Okay, so what is it busy doing is pumping around blood. Okay, it pumps the blood around all around your body, gets all the vital muscles that we need, all the vital organs, all the muscles, whatever you're using at the time. Pumps it upstairs, of course, to our brains, keep us thinking. But it's pumped around this blood, which has got full of nutrients and whatever else it might have in it. Oxygen, particularly important as well, which is carried around in the blood, and lots of different things. Okay, but basically, it's the transport system throughout the body. So your heart is crucial to pumping around all the stuff that your body needs. Okay. So one thing you've heard of probably before is blood pressure. Now, blood pressure is dependent on a few different factors. First of all, blood pressure depends on what we call the heart rate, which is how quickly your heart beats per minute. Okay, so your normal kind of range might be, I don't know, 60 or 70 beats per minute. Quickest way to find out, first thing in the morning, just after rising, take your pulse. You might do it for 15 seconds, times it by 4, and that'll give you your heart rate per minute. So that's the first thing. Blood pressure depends on heart rate, so how quickly your heart is beating. The second thing it depends on is the force of the contraction, or the amount of blood that's pumped out in every contraction of the heart. Okay, so they call that your stroke volume. So basically means on every heart stroke or every beat, how much volume is being pumped out. Okay, so it's boom. Okay, so two things so far: heart rate, how quickly your heart beats; stroke volume, how much blood is getting pumped out each time your heart beats; and finally, what is the resistance? So TPR is your kind of peripheral resistance, or basically means how narrow are the arteries or the system through which you're pumping that blood. Okay, so when we think about it, the blood pressure is affected by those three factors. Now, to talk about the resistance just real quick. So, for example, if your arteries, quite open like this, for example, if it was quite wide and open, then the blood pressure is going to be lower. As soon as you start closing up that artery, so it's obviously really small, the smaller you get, the increase in blood pressure. Okay, because there's more pressure pumping around through your blood vessel system. Okay, we'll call it. So, three things: heart rate, how quick; stroke volume, how much blood per beat; and then what resistance, which is how small or how wide are those arteries or the blood vessel system that you're pumping the blood through. Okay, so those are three things, and it gives you an idea of what your blood pressure is. Now, how do we measure blood pressure? Well, probably heard, oh, my blood pressure is 120/80 in the normal range. Okay, so what does 120 and what does 80 mean? Well, 120 is systolic blood pressure, and the 80 is the diastolic blood pressure. Now, easy way to remember that is systolic is S for superior, for on top. So you could say it's the number on the top, and it's always usually the bigger number. So 120/80, so superior systolic, and diastolic is down underneath, so it's D, I don't know, whatever, diastolic. Anyway, I don't know if you remember it that way, make up something else to remember it if you want, that's cool. Okay, so you got your 120/80. 120 means that is the blood pressure that is experienced when the heart is pumping, right? So when it's going, boom, contracting, it's going to be, the pressure around that blood vessel system is higher than when it's off. Yeah? Well, not off, but when it's not pumping through blood. Okay, So it's in the relaxed phase, for example. So pump, when it's pumping and it's pushing out that blood from the heart and around the blood vessel system, 120. When it comes off, 80. 120, 80. 120, 80. Okay, and your numbers might be different. If you've got high blood pressure and someone like that, it might be in the 140s, so it might be 140, 80, 140, 90, whatever it might be, whatever your numbers are. And you find out your blood pressure by measuring it. Usually the nurse does it down at the GP clinic or something like that. And they'll give you a number using a blood pressure measurer. It's actually called a sphygmomanometer, something like that. Can't remember actually. Sphygmomanometer. Anyway, measure your blood pressure. Usually put the cuff on your arm, pump it up, have a look. They've got the things on, they listen. Okay, so that whole thing, that's doing your blood pressure. Alright, so that gives you an idea of how your heart works. Okay, so there's three factors that affect your blood pressure. It is the heart rate, how quickly it beats per minute. It is the stroke volume, how much your heart is pumping out per stroke. And it is the resistance. So how much resistance is there in that blood vessel system, which is causing the increase or decrease in pressure. So remember those three things, because that is where those medicines are acting. Okay, they act on one of those aspects of your blood pressure. If you are taking what they call hypertensive medication or antihypertensives. Okay, so basically it means high blood pressure medication. So those are the three factors. That's a little bit of background on how that works. Next time I'm going to jump into exactly what medicines do what where, and what of those three parts is affected by what medicines. Okay, cool. All right, catch you back next time. See ya.